If you have a known clotting disorder, can you safely have autologous breast reconstruction? When we think about this, we need to think about two aspects. One, and the main one, is the patient safety. A free flap is potentially a long procedure. It's associated with increased intra-abdominal pressure if you're having a deep flap reconstruction, periods of immobility and some bed rest after surgery. All of that increases your baseline risk for a blood clot. And if you have a baseline blood clotting disorder, are you going to have a blood clot that could be potentially dangerous for you? To answer this question, we often rely on our hematology partners to determine if it's safe, and if it is safe, if there's special pre- and post-surgery blood thinning protocols that we should use. Now, using blood thinners around the time of surgery does carry its own risk, things like bleeding events that might require surgical intervention, but it still might be deemed that it's safe for you to proceed with surgery. The second thing to think about is a flap. Is the flap going to be viable? So remember, a flap needs new blood in and allows the blood to go out, so an artery and a vein. When this new blood flow is being established, if you have a propensity to developing blood clots, there is a chance that you will form a blood clot in that new artery-vein connection that could require us to take you back to surgery and try to salvage it. Now, in the general population, the chance of needing to go back to surgery to try to fix some type of artery blood in or vein blood out problem is usually less than 5%. And then the flap loss rate, meaning we're unable to save it, is about 1 to 2%. This large study looked at patients who underwent any type of free flap, and they had a factor V Leiden deficiency, which was a pro-clotting disorder. And they found that the rate of flap failure was 15%. That's very high, much higher than that 1 to 2%. Now, this is where the informed discussion comes with patients. Is it worth the risk to the patient? Is this their only option for breast reconstruction? But it is objectively a higher risk surgery. Now, what about the patient who doesn't have a defined clotting disorder, but maybe they had a provoked clot in the past when they were on birth control pills or after a long flight or during cancer treatments, or maybe of the patient that's had multiple miscarriages, which can be a sign of a clotting disorder. For those patients, I typically tell them there's so much that we don't know about clotting disorders. There is a chance that you might have one that we just don't understand yet. So I put your risk of a flap failure somewhere between that 2% and 15%. Might be worth it to the patient, but once again, the primary discussion is always, is it safe for you? And then, is it worth the risk?